Dr. Michael Osterholm joins us now. He is the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. Good morning, doctor. We heard the CDC director say she really pleaded with Americans to do something to stem these cases. If we continue down this path of really relaxing our behavior, how bad do you think it could get?
Well, we have, unfortunately, a roadmap for what it could be like, and looking at what's happened in the European countries right now. You have many of the countries that are in total lockdowns, and yet they're still seeing the challenges, even with vaccination, with this new variant, B.1.1.7, the one originally seen in the United Kingdom. This is a virus that's 70 to 100% more infectious than the previous COVID-19 viruses. It's more than 50 to 60% likely to cause more severe disease. And so given that we have still over 50% of our population in this country that is still susceptible to this virus, this is a real challenge.
The president yesterday said that he expects 90% of Americans to be eligible for the vaccine within 3 weeks. Of course, that's great news, but people are still having trouble getting appointments. How do you think that this increase in eligibility will impact the timeline, especially given how hard it is to still get a shot?
Well, I give the administration great credit for everything they're doing right now to get as much vaccine out of the manufacturing area into people's arms. That is very, very good news. The problem is we're still talking about vaccinating 2.7 to 3 million people a day, but remember, that's really only half that number because those are also people coming back to get their second dose. So when you're only vaccinating 1.5 million people a day, it will take a long time. I worry that opening up vaccination to everyone, which we all want to do, that, means that we're still not getting to the high-risk people that need vaccine that now are being basically in a competition to get it. For example, there are still 15 million Americans 65 years of age and older, the group that's at highest risk for severe disease, have not been vaccinated yet. That's what we need to be concentrating on right now.
That's a really good point to focus on. Now, for vaccine passports, we just heard at Ed's piece that they're controversial. Where do you stand on this?
Well, first of all, we're going to do something. The world is going to do something. People do want to know, if you're going to get on a plane, if you're going to go into a restaurant, if you're going to go into a public place, do I feel confident that the person sitting next to me is not likely infected with the virus? And so whether the governments want them or not, I am convinced that you're going to see them eventually be part of our everyday lives. So now what we need to do is figure out how to do it safely, fairly, and effectively as we can. And so I think that the administration is doing a good job of at least laying out criteria for private sector companies. Remember, when I go to the airport today to get on a plane, if I do that, I get my eyeball screened by a private company that determines that I'm the one that is actually there to get on that plane. And I think you're going to see more private companies getting involved with the guidance of government, but I don't see government itself doing the passports.
All right. Well, Dr. Michael Osterholm, thank you.